Hello and welcome to the Sixth Form Virtual Open Evening. I'd like to tell you a little bit about our Level 2 Health and Social Care course. The course is a triple option course leading to an OCR Level 2 Cambridge Technical Diploma in Health and Social Care, which is equivalent to 3 GCSEs. You will have the opportunity through applied learning to develop the core skills, knowledge, skills and understanding required for working in the health and social care sector. You'll have 2 teachers teaching you different units, but this is planned and organised ahead of time. You'll have 15 hours a week of teaching contact and 2 hours a week of independent study. So on top of this, you may also have 2 hours of English and 2 hours of maths, depending on if you have to complete any resits. Okay, there are 6 mandatory units that you will be covering. These are Unit 1, Working in Health and Social Care, which is an exam. Unit 2, Health and Safety. This is an exam. These are delivered by Mrs. Burton, and you will sit your first 2 exams in January. Unit 3 is person-centred. This is coursework. And Unit 4 is safeguarding, and this is also coursework. These are delivered by Mrs. Eckhart. There are 2 optional units, which are Unit 5, Working in Adult Health and Social Care, and Unit 6, Working with Individuals. That's all about working with individuals with specific needs. And again, these 2 units are coursework, and they will also be delivered by Mrs. Eckhart. Okay, the internally assessed units that we call assignments all work in the same way, and you have 4 of those to complete. And this is the work that you will be doing with Mrs. Eckhart. You'll be taught the subject content and make notes in lesson. There will be areas for you to make notes in booklets, and other times you will need to have a notebook. So it's essential that you bring notebooks with you. After all the subject content has been delivered by your teacher, you will be issued with an assignment brief to complete based on the topics that we've just covered. Okay, so students are responsible for their own sixth form kit, such as pens, folders, notebooks. Teachers or friends and family will not be responsible. This is down to you now to bring in what you need for your lesson, so you must come prepared. Once you're working on the assignments, your teacher is there to guide you, but not able to give you any more assistance on how to complete the unit. This will be your responsibility. So this is all about independent learning. You'll have a hand-in date for each assignment, and we will make sure that these are displayed within the Health and Social Care classroom, emailed or in your booklets, so that you know and you don't miss a date. You must hand in your work on the date, always. Students might benefit from having a hard copy diary or using their phones effectively to ensure that deadlines are never missed. So using your diaries on your phones. Okay, managing the course. So as I said, you have 2 teachers. Teacher 1, Mrs. Eckhart, that's myself. This is assignment work, so it's all coursework done on a computer, written, typed up. You have to meet deadlines. Your work may be resubmitted for improvements. Then you have to meet a second deadline. If you don't meet that second deadline, you could fail the unit. If you fail the unit, you could fail the course. Okay, teacher 2, Mrs. Burton, she will teach you the content. You'll have lots of revision and exam practice. You will sit your exam in January, both exams, Unit 1 and Unit 2, and you have an opportunity to resit both of them again in May. Okay, you may have to resit maths and English, and if you are called out during lesson times, it will be your responsibility to ask one of your classmates to take notes for you. Okay, so balancing your time and effective time management will help you develop your organisation skills and make sure that you never miss anything. Okay, Teacher 1 will then assess your assignment work and give you feedback on whether or not you have made the criteria. So if it's a pass, a merit, or a distinction. Your teacher, who does the coursework, which is myself, Mrs. Eckhart, will be pushing you for the higher grades. If you're capable, be prepared to be pushed for the higher grades. You won't be able to just sit on a pass if I feel that you can go higher. If you have attempted a pass, merit, or distinction, but not quite met the criteria, then you may have an opportunity to resubmit your improvements. But this can only be given if I feel that you've made a good attempt at the first attempt. So if you hand your work in and I feel that you've really tried and there's only a little bit more to go, then you probably will get a resub. Okay. You must meet the second deadline of the resub. If you miss this deadline, there is a chance that you could fail the unit. Okay, exam assessed units. Again, this is Mrs. Burton. So in year 11, you had 8 to 10 GCSEs to sit, but this year you will only have 2, plus your English and maths if you have to do resits. The content will be delivered and you will make notes in your unit booklet and your notebook. There will be mock exams to get you ready, and you must revise and try your absolute best. It's best to avoid the need for a resit, so get your best grade the first time. That means you can put it to one side, it's done, it's finished, you don't have to worry about it again. So Mrs. Burton will ensure that you have the best opportunity to be successful in your exams, but it is your responsibility to revise at home. If you don't revise, then you'll know the difference between a pass, merit, and a distinction. So, exam assessed units. Unit 1 is all about principles of working in health, social, and childcare. So, we're following the adult health pathway, so we won't be looking at the childcare aspect. So, learning about necessary behaviours and actions that support and care for vulnerable people. GLH, guided learning hours, you will see it says 60 there. It means the more guided learning hours, the bigger the unit is and the more points towards your end grade. Okay, so a 60 is probably a middle of the range unit. Unit 2, health and safety in practice. This is all about rules and regulations to ensure the safety and security of both service users and staff. So this is a 30 guided learning hours. So that means it's not as big as Unit 1. So these are the hours that we take to teach you, and you should finish the unit within 30 hours. Okay, coursework assessed unit. So Unit 3, working in a person-centred way. This is 30 guided learning hours. So this is what we start off just to get you going to open up with. So it's ensuring each and every individual has a personalised care plan to meet their needs. And it's gaining an understanding of what is a care plan and how do we meet individuals' needs. Unit 4 is about safeguarding. There's 60 guided learning hours. The roles of staff and responsibilities for keeping vulnerable service users safe and secure. So this is all about making sure people do their jobs properly so that individuals stay safe, stay secure, but it's also about keeping yourself safe and secure. So Unit 5, working in adult health and social care environments. This is all about care settings. This assignment is a bit bigger. This is a 90 guided learning hours. So there's probably about 4 or 5 tasks in this one. There's role play, there's presentations, there's different ways of producing your work. This is all about different settings, gaining an understanding of what the different settings do. For example, what is a residential care home? What does a doctor's surgery do? And why are they different? Unit 6, working with individual adults in health and social care environments. Individuals with specific needs. Again, that's a 90 guided learning hours. And it's all about how best to work with individuals with specific needs. What can you do to best support them? And who works with them? So that's all that you will learn about. So student responsibility. Okay, so you will need a folder for your booklets, pens and coloured pens, colouring pencils, Come to lesson prepared. It's a good idea to have a USB to save your work on and get into the practice of emailing your classwork home and from home to school, so you are never left with missing coursework. You will be a sixth form student, so there are no behaviour expectations from you. We will treat you as an adult and we expect you to behave as an adult. That includes wearing the full uniform. So get yourself organised before coming in, making sure that when you walk into the classroom, you have everything you need to start work. Also, making sure you've got money for your lunches and your breaks, because you must have a lunch, you must have a break, you must have something to eat. That will keep you going for the day. Okay, so you will have homework in year 12. So it's not a course that you just do it at school and leave it there. You will have homework. You'll have pieces of homework to complete for each unit to broaden your understanding of the coursework topics. Some homework tasks will be extended research, which will then be shared with the class. You may be asked to present this to your peers. So you might be asked to go home, research something, put it together as a presentation, and then come back in and show the rest of the class what you found. They'll take notes from you and vice versa, you'll take notes from them. And this all helps to put your coursework together. So homework tasks will have a deadline, and you will have revision tasks to complete or exam answers to, whatever that says there, to practice. Okay, so Mrs. Burton will put exam answers together. You may do some of these in the classroom, but you may do some of these at home. So be organised. You might need a diary to bring in. We can give you a planner if that will help you. You may want to put all your information on your phone. If you're like me, I put all my dates and everything for my diary on my phone. You may do the same. Okay, so what after level 2? What's next? So the CTEC Level 2 qualification is intended for learners who want to progress into health and social care apprenticeships, or who want to progress straight into employment, or who want to progress onto the Level 3 Health and Social Care Health Studies course at UAH, providing you pass your GCSEs English this year and preferably your maths. So it's all right if you have no idea what job or career direction you intend to take. This qualification explores different aspects and different experiences. So careers and job roles. Apprenticeships are on-the-job training and are a range of careers in health and social care, such as SEN school support worker or adult social care. Or you can go into employment, any direction you want to, not necessarily in the health or social care. Doing the health and social care course gives you an understanding of how people function and why people do what they do. So this will help you in all employment areas, really. So after level 3, if you come on to level 3, you can then go off to university and get your university degree jobs, such as nursing, social work, teaching, public health, youth and community work, etc. Okay, there are lots of jobs available. There's a link there that you can go on, Skills for Care, and that will open up all the different jobs that are available. So these are your teachers' emails. So thank you for taking the time to find out more about what we offer here at University Academy Holbeach. Please post your questions or email us and we'll answer them as soon as possible. Enjoy your evening and many thanks for joining. Thank you.